One of the most common questions that faces a patient and a provider after the diagnosis of Castleman's disease is, what are my chances? What happens next? What is the prognosis with this disease? And the challenge in this is that many patients and providers will look at the internet and will find studies that show very high mortality rates with multicentric Castleman's disease, and that can be very alarming. Some studies you can find on the internet show less than 50% of patients are alive 5 years after diagnosis. I think that in all of the studies that exist to date, one has to be very understanding of the fact that the patients included in these series, where they draw the nice survival curves, are patients that are referred and are diagnosed at these centers. So they're the more severe cases. For your common patients who may not have the severe manifestations of the disease, they may not be included in these reviews. But a recent review, looking back at several hundred cases, found that for unicentric disease over 5 years, the survival rate was in excess of 95%, and that for multicentric disease, again, for patients who had received various treatments, the survival rate was in 5-year survival was in excess of 90%. In my own experience, in my clinic, where we have several hundred patients with Castleman's disease, those who are in treatment, and by that I mean even watchful waiting, but those who are under observation and being managed aggressively have, none of our patients have experienced mortality due to Castleman's disease. I have seen cases of Castleman's disease that has progressed to lymphoma that's been missed, or cases of Castleman's disease that were not treated aggressively up front, and those cases have led to death. But I would say that in the majority of our patients, over 90%, even with multicentric cases, the 5-year survival is excellent, and I think that I tell my patients that they're likely to enjoy a long and healthy life, especially if they manage to get the disease treated and respond well to treatment. The only way that we can advance new therapies for rare diseases like Castleman's, or even common diseases, are to do clinical trials. The only drug that's been licensed to date for the treatment of Castleman's disease came to be licensed through carefully designed clinical trials that took years to complete. But they are so essential in informing how we deal with Castleman's disease, and there are so many unanswered questions that remain. Unanswered questions about the frequency of administration and the duration of administration of therapy. What is the optimal sequencing of therapy for relapsed or refractory disease? Questions about treatment of unicentric versus multicentric, or idiopathic versus human herpes virus 8 associated. So many, many questions that we don't yet understand the answers to, and only will gain the answers to if patients participate in clinical trials. Unfortunately, we know from national data that in the setting of cancer, even a severe disease for which everyone wants new answers, only 3% of patients at most cancer centers actually participate in clinical trials. This is an enormous missed opportunity. For patients, enrolling in a clinical trial allows access to a therapy that can be really revolutionary. For the first several years that cetuximab was being tested, it was only available through a clinical trial, and patients who had access to it had remarkable successes. So I would say that it's essential that we continue to design and deploy clinical trials, and that we continue to encourage our patients to enroll and participate in these to answer those remaining unanswered questions and help us to advance new and more effective therapies, or use existing therapies more appropriately in the setting of this very rare disease. A very important question in patients with Castleman's disease is when to treat, what to treat with, how to treat, and how to monitor. And these are all very complicated decisions. Although I'm biased, I would definitely say that patients with a rare disease, it's important for them to see specialists or providers who have seen other patients with that rare disease. And unfortunately for Castleman's, because it is such a rare disease, there are very few centers where a critical mass of Castleman's patients have come, and where the experience with those patients is recognized by a small group of providers. I think just like anything else in life, the more often you do something, the better off you become at it. So it has nothing to do with brilliance or the clinical prowess of providers who are at specialty centers, but I think it just is really attributable to seeing enough volume of patients with Castleman's disease to understand when therapy isn't going well, or what are the variations in the disease that prompt you to choose one therapy or the other, or even what's the best way to monitor patients, or what might be subsequent clinical trials that are offer options for patients that have little options otherwise. So I do believe that a patient with Castleman's disease may be best to visit a specialty referral center where there are a number of patients with Castleman's disease. Oftentimes, that may just be a single visit to confirm the diagnosis, to establish a treatment pattern, and then these patients can be referred back to referring providers that may not have as much experience. I think through that interaction, you can actually build the capacity to treat this rare disease in the community setting. And I think that for myself, we've had a number of patients referred to our specialty center actually by the same providers in the community. And now, after referring a couple of patients and discussing and reviewing management plans, those providers feel very comfortable in treating patients with Castleman's disease. Certainly the ease of administering some of the newer therapies like cetuximab makes treatment in the community and not at specialty centers a really viable option. Not everyone can get to a specialty center. It can be, it can be challenging or expensive. And so I think that over time, as this disease becomes more broadly understood, more treatment can be outside of specialty centers. But I think today there still is value for a patient being seen by a provider that has seen a large number of Castleman's patients and has a lot of experience in the disease.